you need to be even more intentional. And I love the word intentional, because you have to be intentional with your parenting, just like you said. I have my babysitter. It's super funny. My babysitter who babysat my kids when they were 1, 3, and 5 is now having kids that are 1, 3, and 5. And she's texting me saying, Sarah, I'm so afraid to raise these kids in this age. How did you do it? Your kids are so well grounded in this world of wokeness and everything. How are they? And I said, Miranda, you're going to be fine, because it's all within the home. And when you're intentional with your parenting, your kids are going to have the values that you instill in them, but you've got to do it when they're young. And so that's where I want to get into your first most imperative, non-negotiable parenting principles. What would they be?
Absolutely. And to build on what you just said also, I think I say often on my podcast that we are each our own primary healthcare provider, and that the responsibility, of course, lies within us. And for moms, we're also the primary healthcare providers for our children, because it's all of our daily habits and choices that actually build our health. It's not the 5 minutes in a doctor's office. And I think the best outcomes happen when we have great partners in that and practitioners who have very specific knowledge and can help. But I like to always remind people on the health side, the responsibility is still within each of us. And as moms, that applies to our children as well. But also, like you said, to the mindset piece, when in both the education and the parenting side, I try to think in first principles whenever possible. And I feel like this isn't often applied to parenting, but I think it actually simplifies things a whole lot if we take a first principles approach. And for people who aren't familiar with that term, it basically means simplifying something to its absolute core pieces and then building from there, like distilling them to the point at which they cannot be further distilled. So when I did that with parenting, what tops the list for me in my approach with my kids, and that sort of governs all the decisions below that, is the idea that each of them are their own infinite autonomous being. They are not an extension of me. They are not a part of me. They are each their own infinite autonomous being. And that lets the family culture be built and the decisions be made from that perspective, in honoring and valuing their autonomy, in realizing that the goal of parenting is not to raise children, it's to raise adults who are hopefully doing something positive in society. And that doesn't begin when they're teenagers. That begins day one. And of course, there's a sliding scale where they need a lot more hands-on help and involvement at young ages. And then that gradually goes down over time, so that by the time they're older teenagers, they are essentially already self-sufficient adults who might still live in our home. But there's a whole lot of course, micro decisions that go between that. And I think if we approach parenting with that as the first principle and in the forefront, it helps really shape even our day-to-day interactions with them, because it's not that I'm dictating behaviors and health culture and everything within the home. It's that we're co-creating this culture together, and that each of these infinite autonomous beings that lives in my house is contributing to that. And in little ways, that helps, for instance, with the idea that mom's responsible for everything in the house. And if they do anything in the house, they're helping me. And instead, that moves into a mindset of we are all contributing to this together and building this together. And your input is as important as mine. And you are your own infinite autonomous being, just like I am. And so I feel like it brings a level of respect to those conversations, and also reinforces the importance of modeling, which I know you talk about as well. But what we say to our kids hopefully does get through sometimes, but they really, especially at young ages, pay so much more attention to what we do. And so whether it be in the health world with the habits we model there, whether it be in how we show up regulated, hopefully in our nervous system, in our interactions with them. I love that sort of conscious parenting piece is entering the parenting conversation more and more these days. But even just the simple idea, if they're their own infinite autonomous being, I'm going to treat them as such, and I'm not going to meet their dysregulation at times with my own dysregulation, which will then just amplify the dysregulation in the household. As a side note, I think it was really fascinating when I learned that when kids are really little, like before age 7, they not only don't have a fully regulated nervous system, obviously, but their nervous system actually depends a lot on the parents. And that's how they develop their own nervous system, is through direct physical interactions with the parent. And so in a very real way, a mom's nervous system sort of sets the tone for the entire household. And so I think also, like, one of the best gifts we can give our kids is our own self-regulation and being able to show up calm and collected and be a safe space for them to feel emotions, without giving them big emotions back all the time, and help them learn through that safety net that there is a difference between the emotions you feel and the actions you choose to do, but your emotions are okay. And I'm a safe space for you to feel your emotions. And let's talk about any actions you might choose to do as a result of feeling a certain emotion, but help them develop that framework from an early age. And I think when we operate from that place, all of the smaller decisions around health or parenting or anything become so much easier because we're operating from the first principles.
Oh my gosh, I love that. Number one, to highlight what you were just saying with that nervous system transference to the kids, it is so important for us moms to take care of our mental health, to take care of ourselves so that we can show up in a calm manner, because so many women are running around with adrenal fatigue and just like, you know, just going through the motions. And when the kid's in the way, then they just flip out or react in a way that is hurtful and not productive with the child. So you're